What's up, YouTube watchers? I'm just laid back here, kind of bored. I did want to react to a video of Mr. Aaron Boster, MD. He is a neurologist, and from what I hear, he is pretty good. I want to get into it and let you guys check it out. So, this is rare and unusual multiple sclerosis symptoms. And he's going to explain everything, like what's rare that he's seen, pretty much. So, let's get into it.
Multiple sclerosis impacts the supercomputer, the brain that runs the whole body, and the superhighway, the spinal cord, that takes the information from the brain down to the toes and back up. In essence, it can cause almost any symptom, and some are much more common than others. In this video, I'm going to share with you the most unusual and rare MS symptoms I've seen in a decade and a half of practice. If you'd like to hear more, stay tuned, because I'm going to start right now. Learn about MS with me, Aaron Boster. I started this channel to help my own MS clinic patients learn between visits. And it's my hope that through these videos, I can help you learn too. I use easy to understand language to bring you approachable and accurate multiple sclerosis education.
It does.
So if you're impacted by MS and you want to up your game, make sure to subscribe to the channel right now. And please ring that notifications bell so you don't miss any of my upcoming educational content. Multiple sclerosis is an autoimmune inflammatory condition that affects the brain, the supercomputer that runs our entire body. It also affects the spinal cord, the superhighway, that takes the information from the brain down to the body and back up. As you can imagine, you can see a myriad of neurological symptoms as a result of the inflammatory damage of MS. And certain symptoms tend to be more common. It's not uncommon that we see involvement of the optic nerves, or transverse myelitis involving the spinal cord, or classic brainstem syndromes. In this video, however, I'm going to share with you the uncommon, the most rare and unusual MS symptoms that I've seen in the last decade and a half of MS practice. Number 1, psychosis. On one occasion in my career, I saw an MS patient who was admitted into the hospital with terribly bizarre behaviors. She was suffering from psychosis. She had a break with reality and didn't understand what was going on around her. She was hearing and seeing things that weren't there, and she thought things that weren't true. It was very, very scary for her and very scary for her family. We did an MRI of the brain and found a very large and enhancing lesion in the frontal lobes, and we gave her IV steroids, and the psychosis completely resolved. Now, this is a very unusual MS symptom. I've never seen it again, and I hope to never see it again. But it was very clearly an MS attack impacting the frontal lobes, and the result was psychosis. Number 2, status epilepticus. It is true that people with MS are up to 6 times more likely to suffer seizures compared to the general population.
6 of them.
And that makes sense when you consider the fact that MS can, in fact, affect the cortex, the bark of the brain, the outside surface. And if there's an inflammation in the surface of the brain, that can trigger a seizure or an electrical storm. A few years back, I saw a patient that came into clinic, and she was acting really weird. She sort of stumbled while she walked, almost like she was a little bit drunk, and her family kind of helped escort her in and sit her down. She was awake and talking, but she wasn't making a lot of sense. And she kept saying, "I love you, I love you, I love you, I love you." And when a staff would approach, she would hug them, and it was really hard. It took 2 of us to pull her off of someone. Very, very unusual behavior. She had a tremendous difficulty in answering any question. We admitted her into the hospital, and when we got an EEG, we saw that she was suffering from a prolonged seizure, complex partial status epilepticus. Now, we gave her high-dose anti-seizure medicines through the vein, IV, and we broke the seizure, and she normalized. We formally diagnosed her with epilepsy along with her MS. She's now on anti-epileptic medicines and is having no problem. But this was a highly unusual situation caused by status epilepticus in the setting of MS. Number 3 is called pseudobulbar affect. Now, this isn't completely rare. I may see this a handful of times each year, but it's very unusual, and I want to spend a few minutes explaining it to you. When you are upset and cry, there's really two things going on. You have the emotion of sadness. You feel sad inside. And you have the affect of sadness, meaning that outwardly you're sad, you're blue, you have tears coming down. In this example, your emotion of sadness and the affect of appearing sad fit. Unfortunately, in the setting of MS, sometimes the circuitry of the emotion and the affect become decoupled. And what you can have is what we call pathologic crying and pathologic laughing.
Yeah.
Someone with
both of 'em.
pseudobulbar affect
Both of 'em.
will start bawling, crying,
weird.
unstop, and
Oh, wow,
they're
I
not
didn't
sad.
know.
They literally are saying through tears, I'm not sad, I'm okay, and yet they can't stop crying. Alternatively, someone can start belly laughing, and
Yeah.
it's so
Laughing.
loud and remarkable.
Before I
except
got
they're not
diagnosed, I was
feeling something
laughing
funny.
like crazy.
They don't think it's that funny.
When-
They
yeah,
can't
it
stop
wasn't
themselves
funny.
from laughing.
But I was laughing
This is called
anyway.
pseudobulbar affect, and it is a very frustrating symptom because everyone around you doesn't
So
see the emotion
weird.
inside, they only see the affect. Now, fortunately,
Strange.
there are medicines that can help pseudobulbar affect, and I have had great success in using them in MS patients. But I certainly think that this symptom deserves its place amongst the rare and unusual symptoms of multiple sclerosis. Number 4 is loss of humor. There's a story recounted to me by one of my dear patients. After going on a highly effective therapy and seeing many aspects of her MS improve, she shared this story. She said that she went home for a Christmas holiday and her family was shocked. They sat her down at the table and they said, "Honey, you've regained your humor. You understand our humor again." And she said, "What do you mean?" They said, "For the longest time, we would make jokes and we would laugh with each other and you would stare at us and you didn't understand and we didn't know what to do and we didn't know how to tell you. And we're so excited that you got it back." She said, "Dad, why on earth didn't you tell me?" And he said, "Honey, I didn't know how to share that with you." The take home here is that this young woman literally lost her ability to understand the humor in her family. And fortunately, after exposure to highly effective therapy, gained it back. This is a very unusual symptom, loss of humor in multiple sclerosis. Number 5 is an attack of cog fog. Now, cognitive fatigue is not uncommon in multiple sclerosis.
Yeah.
And amongst MS, it's not that unusual.
I have
But I'm
medicine
talking
for
about
it.
an MS
I
attack
take
that doesn't involve
when
the
I have
eyes,
it.
it doesn't involve sensation or strength, it doesn't involve balance, it involves thinking. Someone who is normally very clear of thought and able to process very quickly is suddenly in a profound cog fog. Without other symptoms, they're struggling in life, and these patients will present to clinic super confused and very upset and not sure what's going on and fearful that they're developing dementia. And when you
Yeah.
give someone like this steroids and you quell the inflammation in their brain, the cog fog lifts.
Sure,
And so an
man.
attack of cog fog is somewhat rare in MS. I do think that clinicians don't look for it enough. And I do think that when you see it, we need to treat it. Attack of cog fog is number 5 on my list. Number 6 is intractable vomiting, meaning vomiting that won't stop.
I've heard
A
that
wonderful
one.
patient of mine presented to me in clinic, referred urgently. And during the interview, we were unable to have a conversation because he was holding a trash can and throwing up the whole time we were talking. I had to admit him into the hospital. Quite literally, he was retching nonstop. He no longer had food in his stomach and he couldn't stop from vomiting. Now, this patient had brittle diabetes, and it was our assumption that the problems with the diabetes was leading to the intractable vomiting. We called in the endocrine teams, who called me and said, "There's nothing wrong with his diabetes. His diabetes is under good shape." We got an MRI of his brain, and in the medulla oblongata, in the centers that control emesis, he had an enhancing lesion. We gave the brittle diabetic steroids, and the emesis disappeared, the vomiting disappeared. And so number 6 is intractable vomiting, a rare and unusual symptom that I've seen in multiple sclerosis. Number 7 is pathologic itching. Pathologic itching has been described in the MS literature, but I don't see it very often. I specifically remember a wonderful woman that came to see me. She suffered a lesion in the back of her spinal cord, a transverse myelitis, and it didn't affect any motor function, no bowel and bladder function, but it caused her to have a profound itching. It's now been over 10 years, and the itching has never stopped. If she's not careful, she'll literally scratch herself to bleeding while sleeping. It's a terrible symptom that plagues her and damages the quality of her life. She's worked with numerous doctors, including special dermatologists, and taken literally lotions and potions, and struggles to this day with pathologic itching from multiple sclerosis. Number
I've heard of
8
that.
is heat-sensitive erectile dysfunction. Allow me to explain. Many years ago, I gave a patient 4-aminopyridine, or Ampera, to help with motor fatigue. And in follow-up, as we were wrapping up the visit, I said, "Oh yeah, by the way, how's the Ampera?" His wife smiled and said, "Sir, you may never take away his Ampera." I said, "What do you mean?" And she said, when he was diagnosed with MS at 18 years old, he developed erectile dysfunction. And to date, he has struggled to obtain and maintain an erection. When you gave him Ampera, it was like he was 18 again. In reality, as his body heated up, he developed erectile dysfunction. And this happens very frequently when you're intimate. By taking 4-aminopyridine, it buttressed against that, and he is now able to have meaningful erections and meaningful sex. Unusual symptom, I'm delighted that it's better. Now, I would like to hear from you. Have you experienced an unusual or rare MS symptom, or has someone you loved experienced an unusual or rare symptom?
Yeah, Dr. Bosser, very intelligent. I like to watch his videos all the time, and I've done videos reacting to him. And if you want to go check yourself out, I mean, he's a he's a great doctor when it comes down to MS. So, guys, I've been on here too long. So be good. I'll be good at it.